This video illustrates the possibility to use microwave tomography, here using an MD100 system, to detect and locate a 60 mm bleeding under the skull, hence an intracranial bleeding. Measurements are performed on a phantom, mimicking a human head with a brain. Inside the brain phantom, we then place a balloon, filled with a liquid that mimics the electric properties of blood. This blood volume is placed in different positions, and we observe the results of repeated tomographies. The MD100 system in this study is trained to detect large bleedings in different parts of the brain volume. Here we see a phantom filled with liquid that mimics the electrical properties of the human brain. The head is placed in the headrest of the device, and the torque knob is used to ensure a good match between the antennas and the head. Inside the phantom, there's a balloon filled with 60 ml of liquid that mimics a fresh bleeding in the brain. The emulated bleeding is first placed in the frontal part of the brain, above and behind the phantom's right eye. A microwave tomography is performed. The displayed results show that this MD100 device correctly reveals the bleeding and its approximate position. The emulated bleeding is now relocated to a new position on the phantom's left side, corresponding to the temporal region of the brain. The balloon may be difficult to see, but the rod connected to the balloon shows the relocation. A new measurement is performed. And the new position of this emulated bleeding is correctly presented. Finally, the bleeding is moved to a new third position in the posterior part of the brain, on the phantom's right side. Once again, look at the rod to see the relocation of the bleeding. A new measurement is performed. And once again, the device correctly locates the phantom bleeding in its new position.